Okay, welcome to the meeting of the Children's Services Overview and Scrutiny Committee. We're going to we'll work through the first agenda item. So first is agenda item number 33, which is apologies. Have we had any apologies?
Apologies from Councillor Melanie, but she's substituted by Councillor Rochelle Sheffer-Dubé.
Thank you. Then we move on to agenda item 34, which is the minutes of the previous meeting. Does anyone have any comments or any amendments that they'd like to propose to that? Okay, should we just have a show of hands to confirm the minutes? Okay, no one against. Excellent. So minutes are confirmed. So I'll move on to agenda item 35, which is declarations of interest. Does anyone have any declarations of interest? Excellent, thank you very much. And then we will move on to agenda item 36, public question time. I don't believe we've got any public questions.
Well, we haven't received any.
Excellent, thank you. So on to number 37, member question time. I don't believe we've got any member questions. No. Okay, so agenda item 38 is the education and send update. It's quite a packed agenda this evening. So as we've sort of discussed with officers, I think the officers presenting are going to sort of just give some highlights of the report as we've all had a chance to read them, and then that maximises the chance for us to ask questions and have discussions on those items. With this one, I know there's some of the dashboard items we had before, so I propose that we'll start any of the discussion and things on the new items, and if there is anything arising on the dashboards, we can always raise them after. So yes, so the education and send update is that.
Thank you. Between Julian and me, Julian will start to do the main one chair, and then I can kick in anything I need to add. Julian will lead on this one. Thank you.
Yeah, that sounds great. Thank you.
Hi there. Just to remind colleagues that we're looking at the Ofsted reports that have come in. So you can see there Polehampton, and that has been the inspection for this particular term in this reporting period. We've also got some other schools who are scheduled and some reports due to come. So they will be in the next reporting period. And then just to confirm that success across the education and SEND team being recognised nationally in terms of childcare provision, where in the latest report for the HMCI noted as #1 in England for access to early years childcare in the December annual report. So just a couple of highlights for you there.
Thank you very much. So do we have any questions on this report that we, did anyone have any questions that we wanted to raise to begin with? Jane?
It wasn't a question, it was more an observation that we note that that's a really good outcome. That and the attendance figures as well. Is that in a separate bit? But they were two really good pieces of news.
Thank you. Any other comments or questions with Charles?
Excuse me, I was just going to ask, I note on here the financial figure change that the safety valve report to the DOE projected a 15.9 cumulative deficit, but current trajectory, it's looking like more, it's going to be 19.5 million. Now, we all understand the reasons for that. I was just interested on a broader level. You know, we've got the two SEND schools, the facilities coming in, basically. What other things are coming in the next year or two, basically, that can ease that off?
Chair, if I can come in on that.
Yes, thank you.
Yeah. It is a challenge you are facing in not just working on across the country in terms of the need being increased and the cost, of course, being increased. DFE paying attention to that as well, and the local authority from Chief Executive of DCS and Chief Finance Officer making presentation to the government. In terms of what in the pipeline, we are working with the school to have more in-school resource center thing unit. Last time we already report back and said that we already have 2 being confirmed, the opening soon, and we have more schools showing interest. So we want to create more creative, more embedded thing resource unit in school while we're waiting for 2 free school going to take place, which good news is DFE now have resumed feasibility study after a period of time when they suspended that program. Yes, to answer your question, we are is one of our focus work is to create embedded school inclusion unit or school thing unit. That's the way forward. Probably that's the kind of future many local area are exploring.
Thank you, Chair. I think, and thank you, Ming. I think the term safety valve isn't perhaps a very helpful one. I think there are definite, so part of the programme is really looking at whole system transformation for the way in which children with additional needs are supported in the borough. And there are some, whilst overall cost per head is growing, the actual numbers of, whilst from about, I think, 2018, 2019, we've had a doubling every year of pupils who've required an EHCP in order to access their education. This last year, looking at the figures, we are at the same level that we were last year. And there's a real need in terms of looking at the whole system of support. So we are looking at all of our school estate in conversation with primaries and secondaries, because certainly the direction of travel from the new government is very much around inclusion, making sure that children absolutely have their needs met, and where they do need specialist school placements, that we are supporting those, but where possible and where reasonable adjustments can be made, that we are also supporting those pupils to remain in mainstream, but with the right support in those settings. So we have got more schools who are expressing an interest, and we're in conversation with them in terms of taking that forward and that planning forward.
I was just going to say thank you for that. Basically, I note on here, I mean, 15.9 to 19.5 is about 20%. You know, basically is where we're going to finish. I note on here the comment that while the local authority remains determined to work with the DfE to achieve zero DSG deficit, the review and reprofiling point to the fact that it's not possible to deliver this. Now, which I understand. I understand the reasons why, and I know this is a nationwide issue. I'm not meaning any criticism or negative comment in that, but can you give us a flavour of where you think this might finish?
I think because the programme is within a set number of years in terms of achieving that position, and I think from our profiling that we anticipate that we'd achieve that some distance over that set number of years. So it's not saying that it's not an unachievable position, but it is going to take longer because of the wider contextual factors. And just to reassure, we joined with the Local Government Association, and we have presented the information to Treasury and DfE in relation to the particular profiling within Wokingham, and it's not to, as you rightly say, to decry the huge amount of work that officers, and alongside working with parents and our carers, are undertaking to improve current systems, but this is a national issue in relation to having a financially sustainable, but also equally a system that achieves really positive outcomes for children as well.
Yeah, Rochelle.
Has the DFE given us more money to pay for some of these things that we're going to be doing? Or are they expecting us to do it on the same amount of money with more children needing special help? And because Wokingham is the lowest funded authority in the country, you know, all these kind of other things we always hear. And I know that we don't have extra money, especially with things like the national insurance increase and things like that, which is going to hit us for £1 million. This is just, it's very nice to do all these things, but the money has to be there to pay for them.
So the government are currently reviewing the system of support for children with additional needs. So the SEND system. They have given an additional, so in the settlement, an additional 1 billion was made available. When that is kind of bottomed out, and what that means for Wokingham as a local authority, it doesn't cancel out the significant investment that we are having to make on top. So by our estimations, that would be an additional for Wokingham about 170k.
Do we have more students who need help than some other areas? I know that people are saying that that we seem to have a higher percentage than a lot of other areas.
I think Wokingham previously perhaps historically hadn't recognised the level of need in terms of having the numbers of EHCPs that other areas, and so we have been probably since just before the pandemic, you can start to see that the numbers of children being identified with additional needs grows up, and effectively what COVID did was, I think, surface a lot of issues for children with additional needs, so and compound some of those issues in terms of access to provision and support in a timely way. So what we are seeing, and this is echoed nationally, is that there's greater levels of complexity for the children who are presenting now in terms of having additional needs. There are also things that as a school, as an education system, in terms of making reasonable adjustments that should be factored in. And I think it's widely recognised that there are features of the way in which the education system has developed nationally over the last 10 to 15 years that has meant that there are some perverse outcomes in terms of that have driven the situation that we're currently in terms of the numbers of children who are requiring a plan in order to have what maybe historically a school was able to accommodate and make reasonable adjustments in a considered way. So I think there are multiple factors that have contributed to escalating need, but we have broadly caught up with where the rest nationally in terms of benchmarking, but we were historically behind.
Can I just ask a bit about, I mean, is it interesting about that sort of over the, how that's changed over the educational setting? Is there kind of an example, I don't know, that you've got of not necessarily a specific one of how that shift has taken place? I'd just be what sort of ways?
So can I give that one example that you have told me about? Yes. Do you want to say? The blazer. So in order to, so an example that Sarah and I have discussed is a child with autism who has a reaction and a response to wearing stiff nylon blazers and requires a certain type of shoe in order to in order to be able to do them up easily and not and that requiring an EHCP in order to not have to wear their blazer in school is one example that I have been given.
I think reasonable adjustments have been quite tricky for a lot of schools to do. There's been a loss of TAs, particularly as budgets have been cut, which means they haven't been able to support some of those children that need that transition help in and out of school. And there are lots of reasonable adjustments. There's still families that are really having to fight over uniforms, over ear defenders in classrooms, that sort of thing, particular lessons. And yeah, that's one of the puts a massive pressure on. So that, and a lot of parents aren't being believed if they've got issues at home as well. Sometimes there is a clash, we don't see it at school, so therefore there mustn't be an issue, and the parents are getting those meltdown issues at home. So that also puts pressure on the system, because they then have to go and get a diagnosis, sensory support and professional advice in order to be able to go into school and say, we need you to make these adjustments. You might not be seeing them, but we need them in order to be able to have a family life, and the impact it has on mental health for the young person.
So is part of this that if these adjustments can be made earlier, then that could reduce the need for
if we had a system, and there are, you know, I don't want to say that this is all schools, that we have some excellent schools who are able to accommodate, you know, kind of children and young people's needs. So it's, but that is one example. But if we were able to share that good practice and be able to accommodate, then we may not require a bureaucratic planning process in order to accommodate those needs.
I think we also have to look at Ofsted and Progress 8 points as well, and that they all lead into what a school is judged by. So schools are focused on their Progress 8 points, their GCSE results, and that's not always necessarily the right system for some of our young people, and it adds an awful lot of pressure to a lot of them that crumble under that pressure as well.
Thank you. Are there any other questions on those? I've just got a couple. So linking back to safety valve things, I just wanted to are the targets based purely on the overall financial costs of it, or is it based on number of EHCP? I'm thinking more of, you know, if where things like this building the new schools, which would hopefully save costs in the long term, will those mean there's possibly more flexibility, you know, would enable the local authority to provide more EHCPs if it was necessary for those?
So I suppose a way of example. So we have private providers have moved into the market of providing specialist education for children and young people in much the same way as happened within children's social care placement market. And INMIS, so an independent non-maintained special school, as opposed to a free school or local authority maintained or academy based special school, the placement costs are for a child in a local provision would be anything between about £20,000 to £25,000 a year. For an independent non-maintained special school, those costs per placement are between 60 and 100,000 per year per pupil. So if you are thinking about in terms of the difference and taking a universalist approach, we would be able to meet the needs of more children closer to their communities, having better outcomes more broadly, if we were able to provide that locally within Wokingham, as opposed to a smaller number of children having to travel often at a distance to the borough and at those costs. So not just the cost of the placement, but also the travel costs in terms of home to school transport. So there is real incentives in terms of us having a better local system that will both produce, firstly, priority, better outcomes for children, which has to be the highest context marker. And then secondly, helps to create a financially sustainable system.
Looking at, I don't know if we're going to come on to these in a minute, but the dashboard items, EHCP's been placed out of borough is going up, but we've got the 2 new. Are we expecting them longer term?
Longer term, we would. That's what we would. So
how long do we think that would take before we start to see that come down?
It depends on when the DfE will provide us with those schools, which is what we are pressing quite heavily for.
Catherine, so did you want to come back?
Yeah, no, that was
sort of related to this. Should we not be tracking how many children we're placing in our own schools?
We do.
We do. Oh, it's not just in and out of borough. I'm just thinking that there's a new private one in borough,
Yes.
but it's private.
Yes.
Okay,
So
sorry.
we do track children in in local provision and in independent provision.
Because obviously it must be, I mean, the difference in cost must be more private versus public.
That's what is pushing us in excess of our previously agreed financial envelope.
Yeah, do you want to go, Charles?
Thank you. It was a really quick one. You referred to the Barkham Centre schools. You and I have discussed this before. Obviously, I'm aware of the situation before Christmas. I'm aware this is completely under the control of the Department for Education. Has the situation changed? When might these things open? Is anything known at the moment?
Ming will probably have more of a specific update, but do you want to?
Yeah. We as you know, Charles, Councillor, before Christmas, they short period of time, let's suspend the feasibility study. As you know, new government in place, they want to look at the manufacturer, also local factor, and with a great push from our DCS and our chief executive, is that they resumed the feasibility study. They did not delay it further. As you know, I think they did have a transparent conversation with us, letting us know 2026 initial projection we had 2 years ago is not doable. So it would be 2 years delayed at least, but they still stick to that particular 2028 delivery. No change to that as far as I know. So possibly we'll look at 2028.
Just for clarity, well done if you persuaded them to change their position on that, because that wouldn't have been easy, I'm sure.
That just relates to the feasibility. We want the schools built, so it's maintaining that focus and making sure that the DfE, which was why we did the presentation to the Treasury and the DfE, to make absolutely crystal clear the longer term financial position in respect of us not if those schools aren't provided, and that was really clear, and we got positive feedback for representations that we made. So
Shane, did you want to ask?
So we've got quite a few schools that have been undersubscribed and, with empty classrooms and that may, in fact, be finishing. Are we looking at using and being able to use? Yes, we are. So that's good. Okay, that's it.
Thank you, Rochelle.
Page 18, you're talking about statutory inspection of Anglican and Methodist schools. I just want to ask, are we also inspecting other faith schools? Wokingham is a very interfaith, has got a lot of different faiths. And why are we only doing it on 2 Christian things, but not on other faith schools? Because I'm sure they have some other things that might be useful to inspect.
I will defer
Yeah.
to Gillian.
Yeah, I can take that one, Chair. Thank you. There are 2 inspection, well, there are 3 inspection frameworks across the nation. 2 that relate to schools for whom we have responsibility, which are the 2 in the report. Firstly, the Ofsted one that everybody is familiar with across the nation, and then secondly, a supplementary inspection process for community maintained and, well, let me phrase it better. It's about state funded schools who have a Christian faith or denomination and have a church affiliation. This stems back to the fact that, you know, if we go back 200 years, it was the church who set up schools across the country, and the statutory inspection of Anglican and Methodist schools is what SIAMs stand for, is now affiliated loosely with the Ofsted inspection framework. It is a different framework, and it's put together by that Anglican and Methodist Society to inspect the schools who sit under their purview, but are actually ostensibly run by either academy trusts or community, the community as in a local authority. The inspection of other faith schools, so if they are state funded, would come under the Ofsted inspection framework. If they are independent and private, would be inspected under the independent schools framework, which is the 3rd framework. And that's the one that I don't refer to in the report, because as a local authority, that's not something that sits under our purview. So I hope that explains where the different faiths are, and why there's a focus on the statutory inspection of Anglican and Methodist schools.
It does seem rather prejudiced in favor of them in that, because we should be able to help support all faith schools for all different faiths, because Wokingham is multi-faith. And rather than just doing Christian schools, we should also have other schools supported as well.
Thank you. Is there? Yeah, thank you with that. I just had one brief one back to the schools as well. The 2 new schools now for. I was going to ask, so they're on track for 2026, but that's been answered. But with the new bill which is going through, the school and education bill, which is looking at potentially how free schools and academies work, would this possibly fall under the category of a school which could be built under local authority control, and would that be something which the local authority would want to do? My guess is that possibly with special needs schools, there might be more value with it because it's more intertwined with more of the local authority sort of things, but I don't know what the time frame is, whether it's something that you've considered.
So when the schools were initially planned, Wokingham made a proposition to the DfE that it would have we would have liked to have taken control of the build. It's something that Wokingham has successfully been able to do previously. That wasn't agreed at that point. My understanding from my reading of the proposals within the new bill is that there will be provision for local authorities to commission and create new schools in their area, which currently is we have to go through other means in order to create provision. But obviously that bill is still going through Parliament. There's probably more kind of feedback and amendments that may be proposed as a result of it going through the various readings. So we will, that it is in that bill, but we wait to remain to see what's concluded and what comes into the legislative framework, because currently legislatively we're prevented from doing so.
So is it a bit unsure about the time frame whether if and when that comes in, whether that could apply to these schools or not at the moment? Is
Yeah.
Okay. Sorry, I see two hands up. Ming, do you want to come in with that?
Yeah, very much affirm what Emma just said. Really, when those two schools or supposed to be free school, need to be sponsored by trust like already being on the track, and we believe I think they will still be in the academic trust arrangement, so wouldn't be under local authority control in that sense. Emma just mentioned about internal build. We can still have some chance. We can say whether we can build a school faster or not. Internal future control of the school, we will work in strong partnership with sponsor multi-academy trust to win that. Yeah, I can see your point, and Chair, that you're saying is very much local area partnership is your ideally should be under local authority control. Many other local authority adopt level approach. They want to keep a special school under local authority control, but those two free school we bid as a free school, in not built as a local authority school.
Okay, so it's missed the boat with that.
It's unlikely to deliver them any faster, given the
Yeah. Gillian, did you want to come in that?
It was just to confirm what Ming has just confirmed in terms of the reading of the bill. In the small print at the moment does absolutely say what Ming has just said in terms of those that are already in process stay in the current process. So we kind of are where we are with it. But that, as Emma says, also it's about, there are several readings and committee stages of the bill to go. So we don't know what the bill will actually end up looking like. So thank you.
Thank you. Are there any other?
Yeah. This might be very naive, so I apologise, but it's in my head. We're saying it's £20,000 to £30,000 to support a child locally, and it's 60 to 100,000 to go into specialist provision. Do we
private specialist?
Oh, okay, so private. Do we, on a case-by-case basis, look at what extra we would have to give to not have to spend 60 to 100,000 pounds? Because there's such a huge.
So within each planning for a child with additional needs, there is a scoping process in terms of where that child needs might reasonably and best be met, and the local authority may have a view about that, but there's also parental preference within that, and one of the kind of contributors to an increase in tribunals and challenge to local authorities nationally is about that disagreement that can be created in relation to actually where is a child's needs best met educationally, and that's so there is kind of provision, but what we've seen is an increase in challenge.
Yeah,
I think the other point is when you do look at where to go for schools, we're applying and looking at 30 to 40 schools to find a place for a child. There's just no places available. So that's the other thing that you have to be. It's where is there a space for these children? Because the system is so overstretched. It's not that families are saying, I want to go to £100,000 provision that's 100 miles away. It's where is there a place for my child? And the local authority is struggling with that as well.
I knew it was an annoying question.
No, it's a very complicated
It's not a brain said I needed to.
I think it's
a really valid question to ask. Yeah.
Thank you. Are there any more questions on this report? Excellent. And there are the dashboard items underneath. I know we saw these last meeting. I think other people might have a comment. I think it's really helpful having the sort of indicators and the dials. I think that immediately makes it a lot easier to gauge, and I think it makes a lot more sense to the direction of travel column as well, because I think you can see actually what's happening. So thank you for adding those in. I know we've seen that data before, but did anyone have any questions they wanted to ask on that?
I just wanted to note that I'm worried that I'd missed the reports previously. I was like, oh, what's this new shiny thing? Have I missed this before?
Yes, well, so it's same data, but it's just the new dials, aren't they? So
Good.
So thank you for that report. So and thank you for the officers for presenting that. So we'll move now on to the agenda item 39, which is education in settings other than schools, and handing over to Ming.
Yeah, thank you, Chair. Thank you, Chair. Yeah, very briefly, I believe you all read this paper. We all asked to present a paper on education other than school. It's more complex than that. So that's why we add 3 elements here. What you often heard of alternative provision, or you heard AP, or indeed PRU, etc. And the second element of that is called education other than at school, or people told you IELTS, I believe. The third thing we think in the current circumstances in terms of well-being and school bill, we also present to member the information on elective on elective home education, how send children assess that, what they write, etc. AP is an umbrella name for people who receive education other than mainstream setting, in a school, normal setting. So in AP, again, you can have AP like our foundry school, used to be called People Referral Unit. They are properly registered with the DFE. They are run and managed with a governing body called Management Committee as a school. So then we have other AP alternative provision. Many outline across the country, same. Many outline, or they are registered at the company, but they are not registered at the school. They provide enrichment program, activity, etc., to complement what school been doing. As you can imagine, because of that, AP not just commissioned by local authority. You can look at the number. Local authority actually a smaller number that we commissioned. And school commission a huge number of AP. For our own provision school, AP school, the foundry, we commissioned 47 places for people who are permanently excluded. Local authority do have legal responsibility to find a place for them, even though other arrangement provided. Also, for children who are medical need, they cannot access to school. They need to go to our own AP, as AP. IELTS is legally assessed a process. Those children who need IELTS education other than at school, they have to be assessed and identified in EHCP plan F sector. AP, you don't have to include it in EHCP plan. That's slightly different. In terms of elective home education, as you have heard of, there's an increase through pandemic, a number of children and young people who are in who have chosen to be electively educated by their own parents. So in working on context, we have make arrangement with the school. The law actually said that they not notify local authority, they notify head teacher if a parent want to educate the children at home. They don't even need to tell head teacher why I want to educate the children at home. But we make a local arrangement. We ask parents to let us know why at school now. So when school, we also make arrangement with school need to discuss with local authority officer, children welfare service here in a specific service. Then we need to find out whether the child have safeguarding concern or not, well-being concerns, that we may have some view on that. But at the moment of time, home education internal local authority power is very limited. But unless we have evidence by allowing the child to be educated at home, the safeguarding cannot be achieved, then we can intervene. So that's why we make this arrangement with school for every case who going to be educated at home. We want to assess whether they have safeguarding concern or any well-being concern, or indeed we want to look at whether they have special education need that cannot be met in home environment. So we need to be very, very careful here. We don't want to make judgment because someone has special education need, so he can't be home educated. Under current legislation, you cannot do that. And of course, well-being a school bill. Now, there's a clause in that in the future, all elective home educated people need to be registered in local authority. Kind of already happening. So what power we have, if we find someone is not suitable to be educated at home, we advise parents to take their children back to school. We normally do it through advisory sort of approach, a threat approach. Most parents are happy with our advice, but for some minority cases, they do not agree with us, or they support by some group to want to put up a fight with local authority. We can take legal action. Into legal action, we can take a school attendance notice first. You lay ignore notice, and then we can take it to the court. I was asked to be brief. I think I should give you the 3 aspects our children are not in mainstream school: AP, education other than school, elective home education. Open up for any question that you may have.
Thank you very much. So we'll take some questions first. Yeah, Sarah, do you want to?
Hi, thank you for that, Ming. I think it's slightly important that we separate out those that decide to home educate for cultural reasons and the reasons that, you know, they've always wanted to homeschool their children and have chosen to do that, which is slightly different to those that aren't able to attend school. And families have chosen to remove their children from school and home educate them because they don't feel that they're safe at school. And I know there was a lot of conversation around safeguarding, and I just want to make it really clear that those that choose to home educate or not send their children to school, it's not that it's a massive safeguarding issue, but it is something the local authority needs to keep an eye on, rather than as a duty of care, rather than actually it's an unsafe for children to be doing. One of the questions I did have is around AP provision, and basically a lot of the things that we hear from families is they struggle to find information on it and whether or not there is going to be a comprehensive list around AP provision and what's available locally for families to access and find information on.
Yeah, we have produced a list, but what school, some stakeholders said, can you produce a endorsed list or preferred list? Legally, we can't do it because of the commercial interest that we chose certain bit or whatever. But we're working toward that. We do have a list. Sarah, I think it's the question about how we can share that with the parents. Yeah.
Sorry, Ming, I'm nodding and you can't see that. Yes, it is.
we do have a list. Yeah, we have a list now.
Thank you. Are there any other questions on that? I've got a couple of so yeah, one of them, I think it sort of links onto that, is it looks from the report like one of the themes of challenge is that registering and recording of the different settings, and making sure that, you know, making sure everything's all recorded. I was wondering what the key improvement of this area and what kind of time frame is on that for the sort of registering and recording of those range of other settings and things like that.
Ming, do you want to talk to the quality assurance process?
Yeah, the QA. Yeah, we now have a multi-agency Gillian's team get involved, which is really good because Gillian's team have a school improvement expertise. We have school safeguarding lead not get involved. That's not just the same team, commission team. So we have now have a multi-agency QA team. We also have a schedule to go out to visit those AP, and then to give a judgment, give advice, what they need to improve on, and then we also gain information to inform our decision in terms of whether place children, young people in certain AP or not. I'm very pleased to report back that the area in the past more than 1 year we have been focused on with the help like the team from Julian's team, from safeguarding leads team. Now it's really well embedded. Julian, you may want to add on your team's input on that.
And thanks, Ming. I think it's been a development over a period of time, as Ming has said, and we've come together as a multidisciplinary group of colleagues to give a full view across those alternative provisions. And what we're also doing is putting this alongside a desktop exercise and the commissioning piece. So colleagues from commissioning ensuring compliance against the commission contract. To be able to review some of the documentation and they have as for those placements. So we're checking up on those on a regular basis. Anything that's being flagged from those is coming through into then a follow-up visit. But we're also selecting on a rolling programme a percentage of those providers over a period of years, so that we will be visiting all of them with on-site visits, and then that will be a continuous rolling programme.
Yeah, on top of that, we also safeguarding lead produce advice for some particularly small AP. Some of them can be just 2 or 3 people and to organize some of the company to provide a enrichment program. We give them a sort of list of things they need to do, what they need to do when they have safeguarding concern, etc. They are really grateful actually for that. So that's area is well developed now. We are confident we have the right provision in place in terms of QA.
And can I just sort of, is this quality assurance process, is this a bit quite a new initiative, or is it something which has been continuing, has been already existing for a while?
It's quite new in working, and it took, like Julian said, it took a little while to set it up. Initially, we have what we describe as QA, but actually it's more procurement. I pay you less money, have you deliver how many lessons kind of things, but don't have safeguarding work, don't have other sort of outcome check, children's well-being, etc. So it's quite new.
This is a very important development in terms of making sure that that provision is focused on children's outcomes, and that there are clear outcomes, but also in terms of best value processes as well that we need to be ensuring. So it is something that's been in development, but historically Wokingham has not, that's not been part of the activity that has been undertaken, but it's very positive that it is happening now.
Yeah, as you just said, like in Ofsted thematic review in the end of 2023, listed area chair, as you said, that Ofsted spot across the country is the area that is concerned. We did not do it because of Ofsted review, which started before that. Now we are pleased. Of course, there are always more things to do, but I think we do have a system in place now and it's working.
Thank you. That sounds really positive. Jane.
On the medically vulnerable children, it's good to see all those places are now allocated and well used. We saw a growth post-COVID. Has that settled down now, do we think, or is it continuing to grow?
I think it's continuing to grow and continuing to grow nationally. Yeah.
Do we know what, because we blamed COVID for a while, didn't we? Do we know, are we just better aware, or?
I think probably for lots of children, COVID compounded lots of other issues and in terms of access to support. So I think we have better methods of identification, but I think also post-COVID, children and young people are and families are self-identifying in a way that that perhaps historically was masked by other. I don't know whether you would agree, but yeah. So I think it's more out there, but it is a pattern that is seen nationally in terms of some of the presenting complexities of children and young people that I think various different elements, because it was, I mean, we say sort of the pandemic, but it was also about children and young and families' access to early support, because essential workers, so schools and children's social workers and health practitioners, lots of health practitioners were diverted to helping the system support manage, kind of presenting issues as a result of the pandemic. But that meant that they weren't delivering other early supports that would then identify. So I think we are seeing, kind of more children at this point in time.
Ming, do you want to come in on that as well?
Yes, again, picking up what Emma just said, I think really the pandemic impacted particularly on mental health. It's great. That's another focal area in some sense. So instead of parent or any mental health, they ask for EHCP. So through new mechanism in our report, we mentioned called multi-agency inclusion clinic. They identify young people actually they need some time out in our AP. I would like to report back to chair our AP. The funding is still under local authority control. I'm very pleased with that. And then that's the policy. I think it's kind of preventative work as well in the PRU, so they don't have to go to EHCP process. They can support. Of course, some of them will still eventually need the EHCP process. Just would like to mention we have a brilliant provision also under local authority control. We don't celebrate enough. The Phoenix school, that's another AP just for higher level mental health. Those children really have reached certain level. They normally referred to by medical and social care colleague, mental health social care, not referred by us or by school. They have been doing brilliant job. I think both Julian and I are in the governors, they call management committee. Earlier last year, they received outstanding inspection. Julian may want to say more about Julian's team putting a great work. Supportless setting is a joint venture. It's under local authorities control, like a maintained school, but it's a joint venture between health and local authority. We don't mention it that much, but I would like to say that it's an outstanding provision under local authority control. Julian, do you want to say something about it?
Absolutely, Ming, and a good plug. And I know for members that we have reported on the Ofsted inspection for CAMS Phoenix previously. We're in 2025 now, aren't we? I have to stop myself and think. So in the last calendar year, they had their inspection. They are a pupil referral unit, but the only referral pathway in is through a health practitioner. So they are classed as a bedded unit for children with specific needs, but they are an outstanding provision. And having spoken with the regional HMI, he was also very positive about the feedback from his inspector regarding that inspection. So Ming, you're absolutely right to draw attention to the really high quality practice that happens out there.
So just let you know different tier provision we have under local authority control in working. Actually, we are doing really well.
Thank you. That's yeah, and that's really positive with the Phoenix schools as well. Are there any other questions. I just had one final one relating to. I know you mentioned again the new bill potentially coming through, in particularly in registration of the elected home education. Would you say from that's in this area that is the main difference in the way that the local authority might have to adapt based on what's in there so far, or are there any other changes in this area which you think the local authority might have to build on with this potentially coming through?
Ming, do you want to respond?
I think Chair, because we already built a system. We want school every child be notified being withdrawn, going to be withdrawn from the school. Local authority must be notified. Although in the past, I think before my time, we were challenging on that. Some home education charges said no legislation said that, but now kind of everyone kind of agreed to do that. But internal registration probably is kind of legalized power at the moment through voluntary arrangement. We kind of already doing that internal that policy. I don't know, maybe voluntarily doing that through voluntary way probably even better than forcing people to do it. But internal impact, I cannot see huge impact. But the only impact I can think of that we can intervene more. At the moment, I give you an example. If we want to assess whether education is suitable or not, parents don't have to accept your widget, don't have to send you information. They can provide any evidence they like. But through the proposal, we can actually make arrangement as parents that we have concern, we want to come to which you, and then they have to do that if that bill passed.
I think we just need to clarify that we can if there are evidence safeguarding concerns. So so that's what I understand in terms of my reading of that there would be a register, but the powers of the local authority would be invoked at the point that there were concerns related to reasonable cause to suspect significant harm.
Thank you. Are there any other questions on that report? Thank you very much for all the officers doing. I think that was really informative and yeah, good to hear about those processes, particularly with the quality assurance and the kind of procurement process of those alternative provisions as well. So thank you for those. So we'll move on now to item number 40, which is the home to school transport update. And Oliver, thank you.
Oliver would do that. Yeah.
Thank you. So just to kind of run you through the key elements of the report. So obviously the starts with looking at the financial outlook, and obviously, as you'll be able to see, costs within homeschool transport continue to rise, despite obviously some hard work being doing to kind of to manage that. Key element there that is driving the increasing cost is that we have an increasing number of pupils who require SEND transport. So obviously a lot of what we're doing in terms of addressing focusing to address kind of the rising costs is looking at how we can sort of operate that service more efficiently. And there are three pillars to our approach in that respect. So first is ensuring adherence to the application of eligibility criteria. And the key update since our last report on this is the move from member-led stage 2 panels to officer-led stage 2 appeals panels, with a view to improving the consistency and fairness of decision making at stage 2, both to align it with more appropriately with our policy, and also to ensure that there is fairness and consistency across the decisions that are made in homeschool transport offers. So ensuring that parents receive a consistent offer, irrespective of whether they appeal or not. And that following a decision by full council, the new processes came into effect from the 1st of October 24. And now, as should be shown as evident within the report, there is much better alignment between the decisions that are being made at stage 1 and stage 2. And so far, in terms of the decisions that are made at stage 2, all of them have upheld the council's decision at stage 1. The second core pillar of our approach is looking to promote personal travel budgets. In that respect, councils will be aware that we have implemented new policy from in post 16 from the start of the new academic year in September, which meant that we defaulted to the offer of personal travel budgets in that respect. That's obviously, as one would expect, resulted in quite a substantial increase in the uptake of PTBs at post 16. And we calculated that's resulted in savings in that area of approximately £300,000. There's a more modest uptake of PTBs at compulsory school age, but we're currently working to develop our offer in that respect and to develop sort of a marketing package to really kind of sell the benefits of PTBs, especially with the increased mileage offer that's being made there to parents and families, and to kind of show them the benefits of that, and hopefully kind of we'll see some kind of traction in that over the course of the year. In terms of the third core pillar, which is independent travel training, as we updated last time, we are looking to develop our in-house develop an in-house offer for our independent travel training, following the success of 2 trials in the autumn term. Further to what we've put in the report, there's been some positive feedback received very recently in relation to one of those 2 trials, where the parent emailed us to kind of positively report on what we've done there. To say that the young person is now travelling fully independently to London and has achieved 100% attendance for her first term at her new provision, which is obviously kind of an outstanding achievement and testament to the SEND transport officer who's working on that, who delivered the ITT training in that case. And obviously with kind of feedback like that, where we're kind of obviously making real positive impacts on children's lives, that's the kind of testament, is a really good case for us to kind of build out this offer more fully. There isn't, unfortunately, an update to the report, which isn't so positive, which is that we're actually unable ultimately to appoint to the ITT trainer role in this round of interviews. We're looking to re-advertise later this month. That ITT trainer would ultimately be able, we believe, to be able to deliver about 15 training packages a year, which, on the basis of first of all the outstanding kind of positive outcomes that can deliver for children and young people, would be a real kind of benefit to the local authority as a whole. But it would also, in terms of the cost element, we'd look at saving approximately, we believe, around £10,000 per successful ITT training package delivered, which for 15 cases would be about £150,000 per year. In the meantime, to kind of bridge the gap between our expected appointment to where we'll be, the ITT lead within the SEND transport team is undertaking a further 2 ITT packages to provide for those who've been on the waiting list for some time. And I think that's a good overview of where we are currently at. I'm open to any questions.
Thank you very much for that. Are there any questions on these? I've just got just got 1 or 2. I thought the sort of summary of the ITT was really good and a really positive story, particularly with that one you mentioned. In relation to what you said about the ITT trainer role, was the lack of ability was that because there was lack of applicants or just not the right people? And are you fairly confident we might be able to appoint when it's next advertised?
Yeah. So I mean, I would say we got ultimately transparent. We got 3 applicants, but ultimately none of them were successful. We actually only ended up interviewing 1, which yeah, I mean, ultimately just didn't work out. Other 2 didn't understand that it would take.
I think we're confident that we will be able to appoint next time.
But on that basis, I think we're the reason why we're confident that we'll be able to appoint next time is because we we're changing the remit of the roles, so we're moving from a part-time role to a full-time role, which should hopefully be more appealing to people who are looking for that role.
And thank you for that. And my other question was, now are we confident? Have we got a waiting list big enough that will sort of make sure that that role is fully filled?
Yes. Yeah, we have a waiting list of over 10 children.
Okay, great. Thank you. Are there any other? Sorry, no. Yeah, thank you with that. And the, sorry. Yeah, so my other question, which links actually a little bit to the response to the Send Voices action, but I'm pretty sure in one of those there was one of the points raised was an issue with the independent travel training. Now I know that it's really great that there's been this success story, but I think I'm not sure whether you might have that, but I don't know whether that's the approach to it, or I mean whether it's at the early stages. Has there been any negative feedback with any independent travel training, or has it all been positive so far?
Probably positive.
Great, that's good. That's good to hear. So yeah, thank you for all those. Are there any other questions to raise with that? Thank you very much for those, and yeah, for a really clear report. Yeah, I think it's really positive with the sort of streamlining of the appeals process as well, and that's seen some improvements with that. So thank you very much. So now we move on to item number 41, which is the executive member update. And are you going to do this on behalf of Prue? Because I know Prue can't.
Can do. Do you want me to read it out? Gianna, do you want to read it out?
Yeah. Would you like to present it?
Just need to find it. Sorry. Yes, sec. Apologies. Got it. So this is lead member update because Prue Bray is currently on leave. So in her absence, she's provided an update in writing. Since the last children's overview and scrutiny, I've been involved in a range of activities in respect of our children in the borough. Most notably, I attended a Your Say youth participation and engagement event where I listened to children and young people's views from across 6 schools about what they had felt about living in Wokingham. I'm very pleased to say that the event included hearing from children and young people from one of our excellent special schools. So Addington were in attendance, and really need to thank the staff there for supporting the children to attend. Obtaining our children and young people's feedback was extremely valuable and will be contributing to our youth needs analysis, looking at what support and opportunities are available in the borough and what we need to do to develop them further. I also attended our Holiday and Activities and Food Programme awards ceremony in December, which celebrated the achievements of children and young people who have attended the programme, and there's an item on the agenda that will update in respect of that programme. Our children's social care teams have been busy attending to a number of Ofsted visits in the past couple of months. At the end of November, Bridges, our short breaks residential home, was inspected, where we continued to receive positive feedback about the quality of the service provided. And in December 2024, Ofsted undertook a focused visit which reviewed the experiences and support available for young people who leave our care. A letter with the findings from the visit and recommendations for future development will be published on the 28th of January 2025. In November 2024, the government issued its policy statement, Keeping Children Safe and Supporting Families to Thrive. This outlines the government's vision for the future of children's social care system and its core legislative proposals that are linked to this. This has been followed by the second reading of the Children Wellbeing and Schools Bill, which is currently progressing through Parliament, which is aimed at improving safeguarding arrangements and responses for all children, support for kinship carers, support for care leavers, and addressing profiteering in respect of children's placements, raising standards for every child, removing barriers to opportunity in schools, creating a safer and higher quality education system for all children, and strengthening the role of education within multi-agency safeguarding arrangements. The aforementioned changes and reforms are far-reaching and require close work with our children, young people and key partners in order to deliver successfully. And whilst some additional grant monies have been made available in the forthcoming year to support transformation, it remains to be seen if these new responsibilities will come with longer term additional funding and resources to support and sustain the implementation.
Thank you. I know Prue's here, not here to answer questions, but did anyone have questions which either Emma might be able to answer or we can pass on to Prue in her absence? No. Thank you. So we will move on to item 42, which is the social care update. So, Adam.
Thank you. So this update is broken down into 3 parts. Firstly, there's a summary about inspection activity, which was mentioned in the lead member briefing there. Then there's a presentation that we share with Ofsted, and then there's the dashboard that was shared from the last meeting, but with the additional dials in. So the breakdown around the inspection goes into a bit more detail about the inspection that we were subject to in December. Received a phone call on the Wednesday, and they arrived the following Monday, I believe, or Monday afternoon to inspect in relation to our care leavers. But it also lays out on there, I think, detail we covered in the last meeting about the ILACS process and the inspection process that the local authority is subject to in relation to its social care for children. Now, that, as was mentioned, we've received a draft copy of the outcome of that visit, and then that's published on the 28th of January. And then you can see that letter by looking on the Ofsted website, which is an easy way of just Wokingham and Google in Ofsted, and it will take you through to all our inspection reports, and that will be there on the focus letter, focus document that covers the inspection of our services to care leavers. It was, as with all inspections, we have to set up very quickly, provide a lot of information, prepare a lot of staff to meet with inspectors. It was 2 inspectors that we've known before, previously been involved, and they were also joined by a member of the Department for Education who was observing. And that was just, I think the date was about 10th, 11th of December now. It feels like looking back to last year. Then also attached is a PowerPoint, which is a document that we put together to share with Ofsted as part of our introduction meeting with them on the first day that they're here, and that was to give an overview of our services and provisions to our care leavers in Wokingham, and we feel it provides you with a very good overview of the services that we offer to our care leavers, including numbers and different offers. And then finally on the document is, as mentioned before, is a dashboard, and that's from Q2. But there's the additional dials that have been added that you mentioned before with the education dashboard to give you that indicator about how we're comparing with our neighbours. So I won't go into any more detail because you've had the documents. If you any questions on the process, the inspection, or the presentation, or the dashboard.
Thank you very much for those, and yeah, thank you for all the work with Ofsted. I know it's yeah, it can be a very busy time, particularly before Christmas. So are there any questions or comments that anyone wanted to raise with this? Yeah, Jane.
Sorry. Looking at the NEAT figures, when you take them as a whole, we're behind the national average, but then when you take out those that can't access it, we're in line. What do we do to support young people who can't access?
So when we look at that cohort who we describe as can't access it, maybe because they have young children, parents, or mental health in relation to they're not available for work. So we extrapolate those from the data, and when you take those out of the data, it puts us more in line or ahead of the position. But we try and look at it in both ways when you lift out that cohort of young people.
But the cohort that can't access education and employment, how do we then support them to have a meaningful?
So they'll have
personal advisor until they're 21, 25, and depending on what their needs are, they'll be looking at reviewing that with their pathway plan about engaging them in activities or looking at employment opportunities, and they may change, they may not be consistent over time.
Okay, thanks.
So, and that is an area for development for us going forward in terms of developing a consistent approach to supporting young people who are not in education, employment or training, who are post 18, in terms of some of the feedback that we received. So particularly for our 21 pluses. I'm not revealing kind of, but I think it's an area in terms of just developing some consistency and some rigor in relation to tracking and supporting young people as they go through, you know, kind of transitioning into adulthood.
Yeah.
And they've got the right, ensuring that they've got the right support in place. And we are looking at how we further develop our virtual school offer post 18 to continue to support.
Because if they feel marginalised at that age, it can have a big impact, can't it?
Yeah.
Okay.
Yeah, it's an important foundational stage, isn't it?
Yeah.
For how you kind of launch yourself into adulthood. So yeah. Yeah.
Okay, thanks.
But yeah, and Charles.
I was pressing it, wondering why it wasn't coming on. It was a question regarding page 74, dashboard item 1, early help. The last paragraph of the text, it can be noted that the average length of days between referral and assessment has risen. This figure is reflective of the challenges experienced in the service in terms of management and a sustained volume of activity with a reduced workforce. I think a couple of questions coming from that. It does say there's no target for Wokingham. Basically, it's risen by 4, which doesn't seem to me as an outsider as a lot, but is obviously something that you're identifying. It was really, Wokingham sets itself a target of 30. Is there any kind of national benchmark for that? And also, do you want to talk briefly about what these challenges are and what the department's doing to actually rectify them?
It's quite a lot of questions. So I think working, I suppose, backwards, the as you mentioned, the 30 days is set by us, and I put in here, we did add in a paragraph here because there was a question at the last one of these meetings in relation to why there was some variation in the data, and we spoke at the time around there was a different way in which we were capturing that data, which showed the changes in the top line number of referrals to early help. There has been an increase, and we do have a sort of dynamic waiting process. All families as we're taking them into to provide early help, and there was an increase in some staffing to address some of that additional increase in capacity or increase in demand. I hope that covers.
No, I mean, you've explained basically why, but what's the department doing to actually
doing in relation to managing the demand?
Oh, doing to turn that trend around.
Well, as I say, with increasing the workforce available, there was due to sickness and vacancies, so we increased the workforce to reduce the demand. And we're also currently,
more broadly, we are undertaking work to complete a helping early strategy, and as that doesn't mean, as one of our head teachers did ask us, is that specific to early in terms of Wokingham? And it's not. It is a broader helping early as a doing activity rather than as a in terms of early help, which you know, you can argue in terms of semantics. However, so that work is currently underway. We are working with partners because there was a real need, I think, in the post-COVID context to look at which are the children who are escalating through the system as requiring need, and how are we collectively working as a universal partnership in terms of the offer for children and families. So how are we understanding what are the needs that are coming into the targeted early help service, which is where the stats are in this report, and into social work, and what are we learning from those children and families' experiences so that we can get support earlier in place and make sure that we're working with community, faith and voluntary sector, with our schools, early years settings, so that we're not waiting for families' needs to escalate to the point where they require a referral to a specialist or more targeted service, and that work is currently underway. That strategy is in development, and with an aim for completion in April of this year.
Thank you.
Thank you. I just had a couple of points. On page 70, it mentioned the partnership with London Borough of Camden. I was just wondering sort of what that might entail, really.
So we've entered into a sector-led improvement partnership with the London Borough of Camden. This is sponsored by the DFE. It is in recognition that Wokingham, for about the last 20 years, has been inadequate and then requires improvement. And there is a real need in terms of accepting external support and challenge, in able to support our improvement journey, and we're very committed to that improvement journey. So working with the London Borough of Camden is an outstanding, is classed as outstanding by Ofsted. So we are working to have some, as I said, external scrutiny and challenge around the development of our strategy, our approach, but also working with Camden in relation to supporting the development of relational and systemic leadership, because we are we want to make best use of all available resources, and that requires us to work in perhaps a different way to perhaps previously how local authorities might have operated in these spaces. So a much more facilitative, working with, collaborating with others, and being open to feedback and learning from feedback in terms of that improvement.
Great, thank you. And I was just going to ask as well, I mean, I know the Ofsted letter will be published later in the month, but I was just wondering whether you can, is that what you're going to?
No, you want sneaky Pete.
No, I was just going to ask as kind of broad question initially is, do you feel that from that we're on the right trajectory for improvement, and is there sort of one standout improvement or something that they've identified which is going to be the priority based on the sort of the visit?
I think it was broadly a positive experience, and with some elements of very positive feedback for the local authority. But as with any focus visit, there is also the opportunity to provide constructive feedback, which Ofsted don't resist the opportunity to do, and actually that helps us in terms of that objective overview. So I think they recognised the strong corporate and political support for children in the borough, and spoke very positively about that and the developments that they can see since. And it's helpful to have the same inspectors that were here for the previous ILAC, because they're able to gauge distance travelled. They really commended our personal advisors for the words, I think I can say without what's the word when you kind of you give
Reaching.
the game away in terms of an episode or something. But yeah, so love and care was what they could see that our personal advisors, spoiler alert, that's it, isn't it? So they were able to, and that is mentioned in the letter. The area of recommendation is around the support, the consistency of support for particularly 21 to 25-year-olds. And that's an area of development that I think we accept readily. We were Fortunately, they didn't tell us anything that we didn't know and weren't already working on in terms of development. As is always the case, had they come a couple of months in advance, we would have, in the spring, there are elements that we would have had in place, having recognised earlier in the year that there were some gaps.
It's important to highlight, I think it's covered in the document, I think it's covered, it's a non-graded visit as well. So this is focused, so it's you get a letter rather than a report, and it's not graded. And I think as Emma was highlighting, it's whilst it is a lot of work and challenge in terms of doing it, it is an opportunity to receive some critical friend commentary or feedback in relation to what we're doing in our offer, because these are people that are travelling the country looking at different offers at different standards and raising questions around that. And then they can give you a list of 1, 2, 3 or 4 recommendations that focus on, but during the conversations and feedback, it provides the opportunity to listen to how our services are viewed externally and reflect upon that as well. So it's quite positive in terms of thinking about those areas of focus.
Thank you, and it's good to hear some of the positives, and I guess it's good to hear that one of the areas of recommendation is something that you were aware about as well. So it hopefully hasn't thrown up too many new things to add into the action plan. I guess the final point I wanted to make is what's the next stage with this in terms of the Ofsted, because I believe this focus visit was actually more expected in spring or something.
Last time we were here, we were saying that if we were betting, it would probably be at spring this year.
So is there likely to be another focus visit before the next full Ofsted, or is it?
So they tend to do 2 between each ILACs of the full inspection. So we've now had 2, and we had our last ILACs in 23. So, and then they're 3 months either side, aren't they, of the anniversary date is their target. Is it 6 months? Sorry, 6 months either side of the anniversary date 3 years later. So that'd be March 26.
Well, any time from September this year through to September the following, in September 26, in terms of the ILACs. Of course, there are a number of other inspections that Children's Services are subject to that could. So there's the possibility for a joint targeted area inspection, which is a thematic inspection, and we are in the window for an area send inspection. So
and as Prue mentioned, as we have the annual or the big
engagement meeting.
Inspection of our residential bridges as well, which Prue mentioned, and then also because we're developing our offer in terms of residential, they will also be subject to inspection on annual basis. But this report look mainly at the ILACs, which is the social work offer.
Thank you. Are there any other questions or comments on?
Sorry,
Yeah.
I actually missed what you spotted about working with the authority, and I think that's to be really commended. I think it's brave to go to somebody who's outstanding and bare your soul, as it were, and I think that's a really big step forward.
It's really important for us to be open and transparent and establish ourselves as a learning organisation, because that's how you continuously improve.
But it's easy not to do that.
Yes.
Yeah, thank you for that. Are there anything else from others? Thank you very much for all of those, and for the update, and again for all the work with the preparation with Ofsted. I know it's not the ideal time, just before Christmas as well for that to happen. But thank you for that, and yeah, we'll look forward to seeing the letter with that. And
Chair, we
yeah.
can, on the day that it's issued, we can, if we send to Democratic Services, we can make sure that that's circulated to members of Overview and Scrutiny. So,
Yes, that'd be good
Yeah.
actually if that to be circulated
Yeah.
around. If we can add that, that'd be good for everyone to see. So thank you very much for all that, and thank you all for all the officers involved in the focused visit and the inspection there. So we'll move on to item 43, the corporate parenting strategy. So yeah, that's Adam as well.
So as before, I suppose the document's been shared, opportunity to look over it. So the corporate parenting strategy outlines how we at Woking Borough, and that's all of us, that's not just social care, that's everyone at Woking, will work over the next 2 years to develop and embed our responsibilities as corporate parent. And it recognises that corporate parents, we need to be satisfied that the support we provide to the children in our care and our care leavers is good enough that we would expect for our own child. This document is coming here for scrutiny or comments, and it's also going to be shared with a group of care leavers on a residential as part of some consultation, and then the document will be concluded in its journey of authorisation or ratification or agreement.
Thank you very much. Does anyone have any comments on the document? Any comments on these? I've just got a couple of points, which I'll start off with. So on page 102, sorry, let me find this as well. I thought it was really positive, and I remember, I think we saw it last time as a result of the youth council and the language being used, but about the change from pledge to promise and children we care for. I just wondered on 102, it's still got pledge and things in there. Is that something is one of the aspects which might need to be, what could be changed with that?
I think that's helpful.
Yes, that's been part of the consultation that's happened in respect of this document. So it's useful that you've called that hasn't been updated. So we will, yeah. So thank you for that.
That's fine. I wasn't sure which order things had come in, and just adding to that as well. I know it was the children we care for, and I think in that first green box, it's working as a pledge for children and young people in care. So whether
it will go through once it goes, the residential is happening in a few weeks' time, and then the corporate it will go to corporate parenting board, where the final draft will be, or a final copy will be signed off following that feedback also from young people that weekend. So we will then have a final document that will be signed off by corporate parenting board.
Brilliant, excellent. Oh yeah, Charles.
Okay, there we are. Thank you. A very small point, basically a more material one. 24 to 26. We're in 25 now. The strategy, so it's obviously going to be changed. Page 110 will closely monitor the impact this strategy is having by having a suite of information and data. You may very well be recording some of this already, but I was just going to ask, where is that going to, how frequently is it going to be recorded, and where, basically, so that members and officers here can judge that this strategy is on track and is going to be successful.
To confirm that there is a data set that goes to the corporate parenting board, which I think you'll remember also of, Charles. So we can provide that data set as a specific thematic to Overview and Scrutiny, if that would be helpful, but it goes to corporate parenting board, and the frequency of corporate parenting board is quarterly. The data itself is monitored on a monthly basis by the service, just to confirm.
And the data, the information that goes to corporate parenting. Sorry. sorry, the information that goes to corporate parenting board is richer than or more focused on children we care for and care leavers in the data set or the dashboard that comes to this forum.
Thank you. Yeah.
With the semi-independent living and the transition, I know I think it was brought up at the last corporate parenting. Is that still expanding or?
So, sorry. There's a section in the document we shared with Ofsted in here which covers some of that growth, and in there are numbers, and it shows that growth that we've had since what we had probably last year and how that's grown. And we're continuing to develop properties. So there's one currently being developed which should add 10 beds of accommodation for our 18 plus. And we're also in the process of developing additional semi-independent living, which is aimed at our children in care, children we care for, so under 18, as part of their transition and journey for those that aren't living in a family setting. So we're constantly looking at that, and then also getting that balance right about how big that portfolio becomes to meet the needs of those, as those children, young people transition from care in a family setting, maybe care in a semi-independent, then moving into their own sort of tenancy, and then moving on to final accommodation.
Yeah, Catherine.
Well, it's just to go back to the language being used in the children we care for. What about the Children in Care Council? Is that going to change its name?
I think these are interesting questions, and I know talking to the author of part of this report is around that sometimes that phrase doesn't work in certain sentences. It's about how you use it. So I think it's important about the meaning and not getting caught up in it. And I think that's an interesting point, and that'll probably be a conversation with them around how they would like to describe themselves in relation to that title. That it moved, you know, there's been various different aspects of this, moving away from looked after children that was abbreviated to LAC, and then CIC, children in care, and different terminology. But it's about how what sits well with children, young people, and also I suppose describes which cohorts we're talking about as well.
But sometimes the phrases don't work in the. Yeah. I used to be a technical writer, so
well,
it doesn't work anymore. Yeah.
Well, I know who to ask. Yeah.
Thank you. And one other point, I was just it was mentioned in the previous bit about the LGA corporate parenting review and things. I just wondered whether is there any place for acknowledging that in the strategy? Because I don't know whether that would be necessary.
So the LGA peer review is happening in February in relation to corporate parenting board, and so we will, as an iterative approach, take on any feedback that arises as a result of that review, and incorporate. I think the key thing with this strategy is probably a little less corporate and a bit more parenting, in terms of that needing to be very much our approach.
Thank you. And when's the next Children in Care Council, which will feed into this?
28th February. Is it latter part of February?
Yeah. Thank you. Are there any other questions or comments on this strategy? So thank you for those. So I think the recommendation really is to endorse the strategy and then incorporate any of those suggestions from the minutes in there that we've had. Thank you very much. So we'll move now to item 44, which is the Berkshire West Safeguarding Children Partnership Annual Report. So Estelle. Yeah.
Hello. Right. Estelle is going to present and will introduce this item. And Estelle is our Quality Assurance Service Director for Practice Improvement.
Thank you. So I'll hand over to Estelle.
Okay, thank you. Yes, so you have obviously got the report of the Berkshire West Safeguarding Children's Partnership for 2023-24. The partnership is made up of 3 statutory agencies from across Berkshire, partnered to promote the safeguarding and wellbeing of children in Wokingham, Reading and West Berkshire. The working together safeguarding Working Together to Safeguard Children 2023 is the statutory guidance that sets out in detail the arrangements for the work of the partnerships. It's set out in the report what the function of the partnership is. I'll go on to the kind of summary of the report. The partnership identified 5 main priority areas for the year 23-24, and they are set out in the report together with the progress made against those priorities. And that included the completion of the Berkshire-wide neglect strategy and adoption of neglect screening tools, creation of a multi-agency group to develop the multi-agency auditing across the partnership, creation of a Berkshire West multi-agency safeguarding group and a dashboard, and also a learning and development group to progress and expand the learning and development offer. I think things to particularly note are the change to what was known as the executive group, and that's now the designated safeguarding partners group, and Emma is the chair, took up the chair of that in July 24, and held the first in-person conference in October 24, which set the priorities for the next 3 to 5 years. I think it's fair to say there's further work to do in all of the areas that were identified for the priorities, and some of the kind of barriers, if you like, to progressing all of those are detailed in the report. As already noted, I think in Prue's update report, we, in responding to Working Together 23 and the national reforms, the pilot pathfinder sites have led really to wide-ranging implications for multi-agency safeguarding arrangements. And so to develop that work further, there is now government policy, which again, I think Prue mentioned in her update, which sets out a number of reforms, and that is going to have implications for all of our statutory partners, and also links to an area that was touched on earlier as well in relation to preventative work with families, children and families, and the need to improve that and for there to be multi-agency arrangements to develop that offer, and also stipulating the need to create multi-agency safeguarding arrangements specifically for child protection work. So as a partnership, we've got a lot of work to be doing. The report goes on to mention and reference child safeguarding practice reviews that the partnership have carried out in the year 23-24, but none of those have related to Wokingham children. All safeguarding partners have provided updates, and Wokingham have detailed changes in the fostering service in response to the stable homes built on love, and also the work being undertaken, as we've touched on already, the helping early strategy, and also the success of our recruitment and retention strategy in children's services. The report concludes with closing thoughts from the independent scrutineer, David Goosey, and there's also at the foot of the report details of the financial arrangements for the partnership. And I guess I'm open to any questions.
Thank you very much for that summary there. Are there any questions that people would like to start off with? Yeah, Jane.
My question would be, there's an awful lot in this report. There's so much work has gone on. What's the one thing you're most proud of that you've achieved as a group?
Well, that's a good question. I think I think that the neglect strategy is good, the adoption of the neglect tools, and then moving on to develop the multi-agency auditing arrangements. I think that's something we need to do much more of, but I think it's really good that we've actually got that going. I think it's probably fair to say that we're proud that our DCS is chairing the what is now not called the executive group, but the designated safeguarding partners group. And I think that we are proud that that seems to have given new energy, I think, to the partnership. Right. I don't know if there's anything you'd want to add, Emma, to that.
I think it was really positive that all partners were involved in presentations that we held a safeguarding partnership conference with multiple partners, and that was supported also by Reading University. And we had a presentation from the Vice Chancellor in relation to children and transformation and change that was really positive. And I think it was probably the first time in quite a long time that a number of partners had got together in the same room post-COVID. We talked about COVID impacting on children earlier, but I think it also has had an impact on communities of practice, and there's much to be gained by us coming together and working together more effectively, and not just when things go wrong. So also sharing some really positive practice, which there was an opportunity at that conference, so that was really positive. Right.
Thank you. Sort of leading on to that, I wanted to ask that on 146 and 147, I think it was really interesting to see, I think it was those pages, what the other local authorities, local authorities were doing. And I was just wondering if there's any sort of particular things that Wokingham has learnt from the good practice of other local authorities, or whether there's something which you think has been a real highlight of what Wokingham's done that has that other local authorities have maybe taken influence from what we've done in this area.
Estelle, do you want to, Hannah can come in, or?
Yeah, I was trying to find 100, scrolling down to 146, 47. I think it is always really interesting to learn from other authorities, and the conference highlighted that as well. And we had some presentations from West Berkshire, in particular, where we learned about some rearranging they had done in their front door arrangements, I think, to help families at an earlier stage. And I think that that's something that we have learned from and will think about and consider in our strategy. In terms of what we're really proud of, I think that our recruitment and retention in Wokingham and the offer to our workforce, I think if you look across the partnership, I think we've done really well. And we are in a much better position than we have been. I mean, I've been in Wokingham for quite a long time, and we're in the best position we've ever been in the time that I've been in Wokingham in terms of a permanent workforce. And that looks good looking forward to, in terms of the frontline social workers that we've got in our apprenticeships, and the support we provide for our ASYEs. I think that's something to be really proud of in Wokingham.
Thank you. That's really great. Great to hear. Thank you. Sarah, do you want to come on that?
Thank you for that. I was just interesting how the partnership balances the differences around the cohorts of the populations, because they're quite significantly different, and how the partnership works together on that, really.
So there are some real differences, but actually in those differences, often there's real learning. So we had, again, at the conference was a real opportunity to look at, so we had a presentation from Wokingham's Director of Public Health, looking at the different demography, but also the different outcomes that are achieved across the three areas. And so it was really positive to see some of the supports that and the outcomes that are achieved in terms of different groups of pupils and children and young people, and there was elements to learn from each other in terms of where we were in terms of our different offer, and that's being that work was shared and is being taken forward as part of the subgroups, so that we get that more that broader breadth in terms of how we're serving more urban populations, more rural populations, some of the differentials, different communities within the different areas. So there was really positive learning, particularly when you look at some of the educational outcomes that West Berkshire are seeing in the support that is provided for Gypsy Roma traveller children, which certainly Wokingham can learn from, and in terms of development, and equally in terms of the support for different communities that is in Reading, that we can learn from in terms of the changing demography more generally in the Berkshire region.
On page 140, so this is talking about the online, on one of the online sessions, talk about affluent neglect and it being a growing concern. What do you mean by affluent neglect? I'm being a bit.
So I think typically when the word neglect, it's quite a loaded. We talk about language. It's quite a loaded, and there may be a type of neglect that is identified in terms of deprivation and associated with deprivation and poverty. Equally, there is you may when we talk about affluent neglect, it is more likely to encapsulate itself in relation to children who may be spending quite long periods of time on their own, because parents are working away or working in other areas and having to travel. And it's about the type of support and emotional support. So, for example, those children might be spending quite a lot of time on their own, not being supervised, maybe encountering online risks as a result of lack of supervision and support that is available in their homes, which may then lead on to harm and abuse and exposure in that way. So it's I think there are different types of classifications that perhaps we as professionals make, so that we can it helps kind of categorize what might be a more typical behaviours that you might see in relation to the different types of neglect, for example. But there are research studies in relation to the types of neglect that you might see in more affluent populations. So it doesn't mean that neglect doesn't happen, because actually somebody is more economically able to support themselves. There's emotional neglect, lack of supervision. It's those sorts of scenarios that present themselves when we talk about affluent neglect.
Thank you.
Thank you. I just wanted to ask as well, on page 152, where it's the kind of thematic analysis of, I think from the independent scrutineer, there's some quite strong things it seems there about the sort of failures within this, which I know are sort of within the context of everything. But I was just wondering where these sort of improvements, or where it's identifying failures within or weaknesses in the safeguarding practices. Is there? I was wondering sort of what sort of level this is happening at. Is this identifying at sort of high level in the local authority, or is it in with safeguarding leads in schools maybe, or even at the sort of front line with teachers or carer, whoever's on that front line, or is it a combination of all of these when it comes to these improvements?
I think it's a combination of all of those, and the role of the independent scrutineer is to scrutinise and to challenge, and the action. So this report was submitted at the end of 2024, and part of the reason why we had the conference and the resetting of priorities, which is what we're taking forward for the new financial year, was to be able to reflect on David's, the independent scrutineer's challenge to us, and how we incorporate that into planning for and improving our responses in relation to the areas of priority that we're going to reset going forward into 2025, and we're setting a 3-year strategy so that we've got ample time to focus on both those strategic right down to operational delivery, because this is about how the whole system is working or not. And the way in which we surface that and kind of scrutinise that and respond and get our system working in the most effective way possible. So,
and how does that filter through to, again, the sort of, I guess, the front line of everything? Does that go through, again, all the kind of schools and everything like that?
So there is an executive, a lead safeguarding partner executive group, which is with chief exec, borough commander and ICB leads. So at every level, and then a delegated safeguarding partnership, which I chair, which is kind of the next rung down. And then what sits underneath that is what are called ISIGs. So they're local safeguarding groups of practitioners that work in each of the 3 areas. And then within that, there are also subgroups. So there's a whole system in terms of information that's feeding from first line practice, what we're learning about children and families' experiences, what works, what doesn't work. And part of what we've been doing over this last year is to make sure that we've got the structures in place strategically to be able to support the best conditions for good practice to thrive across the multi-agency partnerships. So not just within our own remits and responsibilities, there's a role that we each play in being able to challenge partners as well in relation to practice being good enough for children and families and help keep children safe in the local area. So there's still work to do in relation to making sure that we've got, kind of a system that is as watertight as it possibly can be.
Thank you. Are there any other questions or comments on that? So thank you very much for that report and for that presentation, and for answering all those questions, and for all the positive work in that area. Thank you. So we'll move on to item 45, which is the holiday activities and food programme update. So who's presenting? No one's forward.
Me?
Just in terms of,
under my colleague's area,
I can probably,
but I can,
yeah. Didn't know
But
whether
you-
we had Hayley online. I don't
Hayley
think
online?
she
Yeah.
may have dropped off. Hayley's
Yeah,
got.
Yeah, but
so,
you are thinking. I think member or read the report is literally the update
yeah,
on
so
this
this is a,
program, and really want to refresh our members and understanding how this program is funded by DFE holiday activity initially and food program. You remember during pandemic, and then we. In working on, we developed really good local delivery strategy, link up with other things we're doing, like a vulnerable learner, like a saying cover, like in this program, we do have a special program for SEN children, etc., which has been well received. So this program, this report, just set out all the progress we made and really bring to members. Attention, like member to notice the achievement in this area. I think our DCS and lead member, I couldn't attend award ceremony for young people who benefit from this program and who achieve in different ways.
So it's open for families who access free school meals. It provides enrichment opportunities, voluntary work opportunities during holiday, and there's some really positive feedback. And we also get really high levels of taking up the programme, and have got a small team that have worked to really develop the programme, which includes provision for children with additional needs as well, which doesn't happen in all local authorities across the country. So that's been a really positive development in Wokingham.
Thank you. So we'll go to any questions with Jane.
Just for a change. This is a personal favourite of mine. I think it's an amazing service and support that's offered, and it's interesting, it's grown year on year. Are we expecting, when we extrapolate a full year for 2024, it will continue to grow? Because there's talk of Ukrainian, Afghanistan and Hong Kong families joining this year, so you would expect a higher number, is that right?
We're still awaiting funding agreement for this forthcoming year, so so we are as all local authorities across the country with I understand that it came through quite late last year, and we're making representation in terms of wanting to know whether it will definitely continue this forthcoming year.
Oh, I hope it does.
Yeah, could I ask with that? I mean, so is there any continued funding, or is it? Are we still waiting for?
It's funding that's been given year on year, in terms of the year ahead, and we are still waiting for confirmation.
And you don't know when we're going to hear yet?
We're hoping any day soon.
Okay.
Because obviously people need to know in terms of their work and the work and the contracts for the forthcoming year. And
would that presumably be for Easter holidays as well as summer holidays and things like that? So the Easter
for the
holidays,
next financial year.
Yeah. So we're still there's nothing planned for the Easter holidays as well, or we can't be certain.
We are making plans, obviously, because the funding is still in place. So all being well, people haven't stepped back from thinking that it's not going to be provided. But yeah, we're still waiting for confirmation.
Thank you. Any other points with that to raise? Thank you very much with that. I think we'll note that report and thanking all the officers for that. And I'll echo Jane's things. I think it's a really fantastic programme, and I know when we had the update on it before as well, it was really positive. to hear of everything which has been happening. So it's really great initiative. Okay, so we'll in that case we'll move on to item 46, which is the response to Send Voices survey and action plan. So you go.
I think if I just open and then I'll hand over to Ming. So at previous overview and scrutiny, we had the really helpful survey responses and feedback from families in respect of issues and also some positives in terms of service provision and what was helping and hindering them. And we felt that it was only right that we, whilst that feedback is contributing to the broader input in relation to delivery plans, that we also brought that back in terms of a this is what you said, these are the things that we are doing and we are planning to do in terms of an overview document.
Thank you. So I'd like to invite any questions. Yeah, Sarah, would you like to start with us?
I just want to say thank you. Actually, this is the first time we've had such a comprehensive answer to it, and we're really looking forward to sharing it with families. And the next meeting that we've got, and I can't remember where it is, with families and our evening session that we do jointly. So thank you very much for a good comprehensive feedback.
So yeah, one of the points I was just going to ask about was I think on 164, I think it's about the EHCP waiting times and what's sort of the key improvement from investment in the SEND team. What will be the key thing to sort of help reduce the EHCP waiting times? Will that investment in the team, is that the sort of main improvement that it will result in?
I think that.
Okay.
Go on. Maybe you
Yeah.
take this question. Thank you, Chair. Sorry.
Yeah, the Chair probably we already summarized in the report. I assume, Chair, you refer to EHCP timelessness, 20 weeks timelessness. We have made some great improvement in past years, but it's not sustained. Sometimes it's because of it's affected by staffing level. Previously, when we reviewed what affect that factor, we look at education psychologists approach and also health colleagues input. We make an adjustment and make improvement, and then we have same teams have unstable team. We have team member left with a very reduced number of colleagues working. As you can see that with the request for EHCP increase, you only have 2 or 3 caseworkers left. So that's the challenge. So with the great support from working on Borough Council's central leadership, we invest to enhance the team to make sure we have good employment environment, good practice in place. We can retain people, we can attract people. In the past, when we try to recruit people, very difficult to recruit. We can already manage to recruit people who want to work for us as a consultant, as an agency, but very difficult to recruit a permanent one. But this time we are very, very successful because of all this coordinated approach. We have recruited 90% of the people we want to recruit in. All those 90% people are going to start it by the end of this month. And I think by doing that, Chair, we will have a greater confidence those increase in EHCP timelessness achievements will be maintained, and we wouldn't have any time, and then we can make sure, I think when there's a challenge, we have more stable team and have good practice being there to support the systems. I mean, that's the key challenge we have at the moment.
Thank you. Yeah.
I think just to echo Ming's point, that is similar to social work. So if we can achieve a permanent workforce that we can train and sustain, and then we're able to establish a much more consistent offer in terms of practice and ethos and communication with the team. That has been incredibly difficult to achieve when it's been a team that's been made up of locums. They can, and being a locum can give a week's notice, leaving things unrecorded on the system, or and that's been part of the issue that we've had. But really positive developments led by Ming and the head of SEN, Jamie Conran, in really leading that and having a really positive offer for caseworkers to feel that they can join, and Wokingham's a place that they can commit to.
Thank you. I just wanted to, I mentioned it very slightly before, but it's on 164, where one of the things which came up from the survey, it's saying issues with service and consistency in the independent travel training. And it was interesting because I know it's quite a small sample size so far with it, but there are lots of positives raised in the homeschool transport. And I wonder whether are those initial issues, have they been sort of sorted out through the development of that, if there's been a lag between when the survey is taking place? I'm not sure. It just seems a bit inconsistent with those kind of bits. I just wondered. Yeah, I was Sarah. Yeah.
I mean, Terry is the guru of the survey and the master of all data, to be fair. But from what I remember, some of that was around some of the clashes where families didn't necessarily feel that travel training was the right thing for their young person, and there was a difference of opinion. And I think for some families, or for some young people, travel training won't necessarily be the right thing, but for other families, I think with the right support, potentially. But it is a big transition to go from a taxi service and into totally independent. So I think it's a journey for everyone in that family, and it has to be handled really carefully.
Okay, thank you. Yeah, I think that answers. Yeah. Great. Are there any other questions with that? Well, thank you for all the actions with that, and I'll echo Sarah's comments about a really comprehensive action plan with that. So I think we'll sort of note that, but I wonder whether we can schedule a review of the action plan in for a future. I don't know what sort of time frame might be reasonable with that, whether it's before. I mean, I know the annual survey comes round annually, and I know, but I don't know whether there's a sort of at time when it might be reasonable to sort of have an update on that action plan.
The findings and the feedback is feeding into the delivery plan that sits under the SEND and inclusion strategy.
Okay.
So it may be, and I know that is in the process of being compiled. So it might be that Overview and Scrutiny want to have sight of that delivery plan in terms of checking and referencing the feedback, and that the actions have translated into the delivery plan. And then there will be we can go into then a review cycle in terms of progress.
Yeah, that might be useful if that could be fed into that. So yeah, so if we can add that into that, and then we can. I will need to check with key colleagues in terms of completion of that delivery plan, and then how that would fit into the ONS cycle in terms of presentation. But certainly that's an action that we can follow up. That'd be really good. And I think following forward from that, in terms of if we get into that regular cycle, I guess, of when those surveys are taken annually, that I guess we can start to get into a system of how we read feedback from that to build on that annually. Okay, thank you everyone with that. That's really positive. So on to the next item, which is 47, the forward programme. So talked about adding these actions in. So the forward programme we've got we've got there just the 19th of March. Does anyone have any comments about those or anything they would like to see added into that meeting or future meetings at all?
Just to say that the ONS Management Committee is seeking the views of the committee as to what items you want to see in the next municipal year. So if you could start thinking about things you want to explore, that you want to see, and indeed, Emma, things that you think are important for the committee, we don't necessarily need to schedule them, but we might want to start make a list of things for the next municipal year.
I think one of the things that it would be really helpful to bring to children's overview and scrutiny is a piece of work that's been undertaken in terms of the youth. Prue spoke about it in her update, the youth needs analysis. So there was but we have now, and we're undertaking the analysis of findings in relation to the survey that accompanied that event. And we had over 2,000 responses, which accounts for, I think it's just over 11% of young people in the borough fed back via that survey, which is really incredible. I think most surveys you can expect to, on a good day, get about 5%. And the feedback from our head teachers who supported the uptake of that survey is that children and young people have spoke really positively about being asked about what they think about their life and what they would like to see in the borough, how safe they feel, and the findings from that report are really enlightening in terms of understanding children's experiences of living in Wokingham, that I think it would be really helpful to share with. So we'll liaise with Luciana and yourself, Chair, in terms of scheduling the outcome of that survey and its findings.
Yeah, thank you. I think that sounds like a really good one to add in there. So are there any other things that people want to raise for now to put in there, and can maybe leave that with people to have a think about, and then obviously you can just email and we'll add anything in which comes to mind. The other thing I just wanted to briefly mention, we had a bit of a discussion about this, and we've had some discussion with other overview and scrutiny chairs as well, and thinking about the potential of, with these meetings, of doing a brief pre-meeting before them, just to, especially I think for agendas like today, when it's been quite packed and sort of wanting to pack everything in, it'll be maybe a couple of days before, likely on Teams, just to discuss some of these and looking at actually the key outcomes from the agenda items and any sort of key things, so we can there can be sort of agreement on could be avenues to go down with questioning and things like that. I guess the consensus I'm looking for is if anyone would have objections to trialing that out at all, or I know it's one thing that in discussion with Neil, some other overview and scrutiny chairs were looking at, and whether it's something we could trial as a committee and see, and then feedback to other chairs. Would anyone have any objections to looking at, or any comments on it either way?
I think having been involved in the discussions and having had some time to think about it, it would just have to be carefully managed so it didn't turn into another meeting.
Yeah,
we'd need to be really focused around what a pre-meet was.
Yeah, I think the idea it wouldn't be with officers or anything like that. So there wouldn't be. I think it would be literally just a sort of brief run through the agenda to pick out any points that maybe, so we could identify, I guess, which items might need a bit more time, a bit more discussion, and so we could just get views of people about what things they wanted to discuss or raise. So we're maybe not duplicating points or questions and things like that. So if people are agreement, we can trial it out. We can see if it's effective, and we can maybe plan how that meeting will take place. Yes.
I just wondered what sort of time of day were you thinking of, and how long would this meeting be for, just on a practical basis?
So I was envisaging, I think we discussed it, it would probably be, it would be in the evening, but on Teams, and probably only about half an hour or something like that. So something very brief, because again, it wouldn't be to do the whole meeting twice, but just a brief sort of summary of the agenda. So okay, so we'll look into that, and we'll discuss going forward with that. Okay, so we'll move on to the next item, which is the action tracker. So I think there's quite a lot of these being completed, which is good. The ones I've identified, so the tribunal updates have been included in the report, which is good. And I think those will be included going forward. The dashboards we've talked about, which is really positive. I think we've all agreed that that addition is really helpful, and then we'll obviously get it with the next quarter KPIs when we have those, and then I think and then we've had the ILACS Ofsted action plan updates in the reports. So and I think that will be continued in those social care ones. Will be continued to update. So thank you for those. The only one I've noted here is incorporate complaint reports in the education and SEND and children's social care. Is that something which can be included next time?
We can take. Yes, we can take that forward, Chair.
Thank you. Okay, is there anything else that people wanted to mention with the action tracker?
I might have missed it. The Send Youth Forum to attend annually. Have we agreed what meeting that would be? It says added to forward programme, but I can't. Oh, is it?
Yeah. Okay. Yeah.
Okay.
Yeah, thank you. Hey, so that's some of the action trackers. So thank you very much for those. So we now move on to item 49, which is public. So before we move on to item 50. Oh yeah, so sorry, so exclusion of the public is under section 100A, section 4 of the Local Government Act 1972. The public be excluded from the meeting for the following items of business on the grounds that they involve the likely disclosure of exempt information as defined in paragraph 3, part 1 of Schedule 12A of the Act as appropriate.